Today, I'll be talking about the cultural adaptation of leadership theories, models, and frameworks as part of my North America Leadership Journey project. My name is Anna Kalbarczyk. I'm an associate research professor in the Department of International Health at the Johns Hopkins Bloomberg School of Public Health. I'm an implementation scientist by training and a gender specialist, passionate about the influence of gender on health and generating evidence on the impact of women's leadership globally. Leadership development in global health disproportionately favors mid and senior level professionals. It is often grounded in Western male centric models, which results in a gap in contextually relevant leadership training. And this gap perpetuates systemic inequities and fails to equip early career professionals. The goal of this work is to inform a contextually driven approach to leadership development in global health for emerging women leaders and male allies. And to do this, we conducted a scoping review of the peer review literature. I began by issuing a call for volunteers in the Emerging Women Leaders in Global Health, or EDGE network, which is managed by the Johns Hopkins Center for Global Health, where I work. The EDGE online community of practice has over 1,200 members from around the world, all of whom are passionate about issues related to women's leadership. And so, based on their interest and availability, we had a core team of volunteers who participated throughout the review and who are recognized here on this screen. Together, we iteratively developed our search terms and aligned on key concepts, including women and allyship and leadership, global health, and concepts around adaptation or modification. We conducted the search in PubMed, Scopus, Business Source Ultimate, and ERIC, and we identified approximately 2,000 references which were imported for a review. And after a review process, 10 were included in the final analysis. These articles were published between 2006 and 2023, though the vast majority, 9 or 90%, were published after 2016. Most articles describe leadership development for trainees and junior faculty in academic medicine and health research. In the peer review literature, this is perhaps unsurprising that those programs that would be oriented towards publishing in peer review literature would publish their results here. A few articles focused on leadership globally, while some had specific country or regional focus. Broadly, though, we saw an underspecification of context where authors made broad claims, but there was minimal grounding of changes or the use of theories in specific countries, institutions, or local leadership cultures. Select areas of leadership development included mentorship, networking, and empowerment, and there was a focus on communities of practice. And many different theories, models, or frameworks were used, though one paper challenged Western constructs of leadership and sought to embed Indigenous principles into existing theories. There was also a limited description of adaptations, the process itself, who was involved, what changed, and why components of programs were modified or dropped. These were rarely detailed systematically. Intersectionality was mentioned as important, but not operationalized. There was limited mention of co-design, so adaptations tended to be top-down, not bottom-up. We identified few evaluations, and we noted that programs tend to rely on institutional sponsorship of participating individuals. But a lack of institutional sponsorship and support and a lack of male allyship are also frequently mentioned as barriers to women's leadership development. And so these two things seem to be in conflict. When I think about how this project relates to the four pillars of the leadership journey, I begin by a reflection on authenticity. Women's leadership is often treated as plug and play, without serious attention to women's lived realities or local power dynamics. And this project questions the tools that I use and maybe that we all use, and how we need to adjust trainings that align with this work more closely and align with authenticity values. The key findings that context is missing, adaptation is underdescribed, and co-design is underused really points to a lack of inclusion. This was strategic work. By mapping the evidence, we can identify leverage points where changing theory use, adaptation practice, and documentation can really shift the trajectory of women's leadership development. And the findings create an agenda for impact by advocating for cultural and contextual adaptation, embedding co-creation into new programs, and requiring programs to improve reporting on context and adaptation. Moving forward, we'll continue to analyze this data set. We'll conduct the gray literature search, and we seek to publish at least one paper on this work to inform our own initiatives to develop women leaders globally. Thank you so much for your time.